Right, good morning to all the viewers. Good morning to everybody. Welcome again to our self-care series. This is the 5th week in our self-care series that I've been presenting together with my co-hosts, Jade Brown and Marilise Laram from Listening Well. We've thoroughly enjoyed it. We hope you have too. And we hope that you're still going to be asking some questions, because today we're going to be bringing you an open discussion, questions and answers, and we hope to be able to also do a roundup of some of the very important topics we've discussed over the past 5 weeks. However, today, before we start the open discussion, I'm going to be welcoming on a special guest that we have for you today, because we're going to be talking about the importance of the topic that everybody is dealing with in South Africa at the moment, which is sexual violence. So I'm going to be welcoming on Melissa van Rooyen, who's going to add to our discussion on this morning. Please ask questions. We value your questions and we would love to do justice to them. Welcome, Melissa. How are you today?
I'm fine, Tanya. How are you?
Also fine. Thank you very much. I think I'd like to start off with a very brief introduction to you, if I may. That's good. Okay, so Melissa van Rooyen is a clinical psychologist in private practice here in Port Elizabeth. Her therapeutic interests include the treatment of survivors of sexual violence. Her research specifically focused on the phenomenological experiences of counselling of South African female sexual violence survivors. Specifically, what aspects of their counselling they found to be the most helpful and unhelpful in their recovery. So we hope that Melissa is going to be touching on some of those aspects today. We'd like to find out some of her research findings. That would be great. I think what is pertinent to point out is that it was the first study of its kind in South Africa, as it explored the counselling experiences of rape survivors following their sexual trauma. So thank you very much, Melissa. I'm glad that you're going to be here today talking about this.
Thanks so much, Tanya, and thank you so much for having me. This is a topic that I'm very passionate about, and as we all know, it's very critical, especially now, given the current circumstances in South Africa. During the lockdown period and during the global pandemic, we have seen a massive increase in gender-based violence and in sexual victimization. And I hope to chat a little bit about that just now. But as you said before, very, very critical and current issue that we're all facing at the moment. So I think it's really a good idea to have this conversation.
Thank you. I mean, as we saw last night with President Cyril Ramaphosa, we've got the stats of 21 women and children who've been killed and murdered in the last couple of weeks. So it's a critical discussion. So firstly, Melissa, I'd like to find out from you, what constitutes sexual violence?
Okay, so Tanya, if one has to look at all of the research out there that exists on the topic of sexual victimization or sexual violence, there's quite a number of definitions. Some researchers have combined quite a few elements together and made up their own definitions. But if we look at the definition in terms of our criminal justice system, and I can see you've put it up there for everyone to read as well. The definition of sexual violence is the use of force or manipulation to get someone to engage in any kind of unwanted sexual activity without their consent. So that's basically as specific as it gets. What do we mean when we speak about sexual violence? That is exactly what we mean. And it's important just to highlight that it is without consent of the individual.
Thank you. Thank you for that.
Sorry,
yes, Melissa?
And then if we were to look at, so that would be the definition of sexual violence. If we were to look specifically at rape, the definition is slightly different. In 2007, it was the definition of rape was redefined by the Criminal Law Amendment Act. And this says that any person who unlawfully and intentionally commits an act of sexual penetration with another without their consent would be found guilty of rape. It's important to note that before 2007, the definition was slightly different. It spoke about penetration specifically with the genital organs. So it really specified the genital areas, whereas now the definition actually includes penetration of any part of the body. So it really just broadens the definition a little bit to include any part of the body of the person.
So that's quite, yeah, that's broadened it quite a bit, and one sees the need for that because it might not just be penetration with sexual organs; it may be other kinds of penetration. Could you
If
give
I
a
can,
few
yeah,
examples?
if I can give an example, so with the previous definition of rape, it was only seen as rape if there was genital penetration. Now, what happens is, because of the change in the definition since 2007, if there is a case where somebody forces a woman to give, if there's a man that forces a woman to give him a blowjob, for example, that would be seen as rape because that is penetration into a different part of the body. So that then would be considered rape as well.
It's unlawful, it's without their consent, and any kind of penetration is considered sexual violence.
Absolutely.
And rape. Okay.
And rape.
Yeah. Thanks, Melissa. I think the next question that I'd really like to ask you is, what are the psychological effects of being sexually victimized? Because I could imagine that, I mean, that must be the most traumatic thing a woman or a child could actually ever face from somebody who's more powerful than they are.
Absolutely. And I think I'm very passionate about this because this is the exact area that my research focused on, which was the phenomenology of rape survivors. So I can talk for days about this topic, but I won't because I know we don't have the time. But if we have a look at the felt experiences, so not just in terms of symptoms, but actual experiences of rape survivors, we can kind of classify them into about 9 or 10 broad themes. And there's actually a book out there at the moment, and I think Tanya's going to put the reference up now.
You gave me the book too.
So there's a great book out there, and there's various chapters in this book that focus on the phenomenology of rape survivors, and this information that I'm going to talk about now is actually from that book, if anyone would like to read a little bit more about that. So if we look at the experiences or the effects of what it means to be raped and what happens after that, what one goes through, the first thing that would probably happen is that they would feel very, very scared. So there's a big element of fear that the person feels after being raped or being sexually victimized. So this can mean fear with regards to the rape itself. So fear that I'm going to be raped again or I'm going to be victimized again. And this is especially true if the perpetrator is someone that's known to the victim or someone that they are maybe in a relationship with. And then the fear also extends to general kinds of aspects. So fear about, myself and myself in the world. So in other words, I'm scared that the world that I live in isn't safe anymore like I thought it was. So there's a big element of fear that happens. And then if we look also at the degree of helplessness and powerlessness that one may feel after being raped, this is both in a physical sense. So if you think about the traumatic event of being raped compared to other traumatic events, when one is raped, they are physically held down. So they are physically forced and rendered into a helpless kind of position. So it's unlike other kinds of traumas in that sense. So there's a great degree of helplessness there. Unfortunately, there's also the possibility of negative reactions from others. So there's still very much a stigma attached to the act of rape and being raped. And if there are negative reactions from others, so for example, if someone encourages the victim to keep quiet, or if they encourage them to keep it a secret or to not press charges, that can make one feel very, very helpless and very as though they don't have any power. There's also a lot of negative expectations with regards to our criminal justice system as well. So that can also make you feel like I have no say in this, or I have no power in this. Okay, then obviously if we look at self-blame, with regards to rape specifically, also different to other traumatic events, because with rape, there's usually quite a lot of self-blame compared to other traumas. So when we talk about self-blame, we talk about self-blame with regards to one's character, and also self-blame with regards to one's behavior. So for example, if a woman is raped, she may feel character self-blame in the fact that she feels like maybe I'm a bad person and that's why this happened to me. When we talk about behavioral self-blame, we talk about things like maybe it was because I wore a skirt or a dress, or maybe it was because I went out late at night and I got a bit drunk. So in that sense, they're blaming themselves for the behavior, or sometimes they're blaming themselves because of who they are. Which we know, isn't the case. And then if we speak about something, if we speak about anger as well, there's often a lot of feelings of anger. When one is sexually victimized or raped, often the anger is turned inwards towards oneself. And sometimes the anger is because there might be this sense of, I should have done something to prevent this from happening to me. Because there's a lot of self-blame, there's often this sense of, because I didn't do this, or because I acted in a certain way, therefore this happened, so therefore I'm angry at myself. When what should actually happen is there should be anger towards the perpetrator.
Well, these are very important things to point out about stigma and about what goes on within the female, the woman's mind or the child's mind who's been unfairly and criminally sexually victimized. Thank you for pointing these issues out. Was there any more phenomenological aspects you wanted to point out?
Yes.
Thank you. No, we need to know these because they're critical. I think it informs all of us so that we don't go around with the wrong ideas or add to any stigmatization.
Absolutely. And if we just, so another one of those, those phenomenological experiences would be something like disgust. And this idea that if I have been raped or sexually assaulted, then I'm dirty, or I'm contaminated, or I'm tainted. So there's definitely a feeling of disgust about oneself. The other thing that ties in with the disgust issue is the fact that when someone is raped or sexually victimized, their body often responds in a way that they don't want their body to respond. And that's because your body can't tell the difference between when you're being raped and when you are in a loving, intimate relationship. So your body will react physically the same. So you might find that a woman is sexually aroused when she's being raped. And when she realizes that's happening, it can actually make her feel a little bit like her body has betrayed her. So there is a sense of, I'm being raped and I know this is wrong, but my body is acting like it's okay, like it should be. But that's because it can't tell the difference between the contexts. So that's also important to remember as well. And then if we talk about things like betrayal and a loss of trust, obviously that's a very, very big and significant experience for those who have survived rape. Often people, I think a common rape myth is that rape happens by somebody that you don't know, and it's a stranger, and it happens down a dark alleyway at night, and I mean, I'm sure that does happen, but often what happens is that the perpetrator is somebody that you know, and somebody that you trust, and somebody that you love. It might even be your boyfriend or your husband. It might be a family member. So the fact that someone has taken part in this act that is completely violating and dehumanizing can really make you question trust just as a concept in itself. Because someone has broken that trust with them. So that's also an important aspect. And then just, there's a large, I think one of the things that many women feel after being raped is just that they tend to have their values and their beliefs about the world challenged, because the way that they thought about things after being raped makes them question whether they really are the way that they were. So, for example, the way that they see themselves, the way that they see their world, they felt safe, they felt that their world was safe, and after a rape, we find that maybe they often question, is the world really safe? Am I really safe like I thought I was? There's also very much a disconnection element to the phenomenology of rape. So, for example, as I mentioned before, the negative reactions from other people. So, there might be this encouragement of others to keep it quiet or keep it a secret because, you don't want to upset the family, and you don't want to press charges because it's going to make it worse, and all of that kind of thing can really create the sense of isolation and alienation for the victim as well. And then I promise I won't talk too much longer about this, but I'm very, very passionate. And then just lastly, just to end off that with that question, Tanya, is if we look at also the impact that being raped and being sexually victimized has on one's sexual functioning and sexual health. So, I mean, HIV, STDs, and gynecological problems are very, very common as an effect of being raped or victimized. Also, if you think about future relationships, future healthy, intimate relationships might be affected as well, because if one is raped and then gets into a relationship after that with someone and is wanting to be intimate with that person, it might affect their capacity to be intimate, because it might trigger some kinds of memories, it might remind them of what happened to them before, so it might actually affect their relationship as well. And then just lastly, obviously we can't ignore the fact that something like being raped is likely to lead to some kind of PTSD. So that's post-traumatic stress disorder. And with that, we've got a lot of symptoms. We've got intrusive memories. So, for example, flashbacks, nightmares, memories that just kind of seem to pop into your head randomly and out the blue and very unwanted, very, very scary for a rape survivor. There's also a lot of avoidance with PTSD. So this can be avoidance of like thoughts and emotions that one feels, but also of physical things. So there might be avoidance of maybe the place where it happened and things like that. And then also a lot of hypervigilance. This is when survivors feel like really jumpy and really on edge all the time. They're very easily startled. And then just in terms of the way that they think about themselves and in their mood as well. So you see a lot of depression with survivors of rape and sexual victimization. You see you see how they think about themselves and the way that this has changed. So that also forms quite a big part of PTSD. So I think in general, all of those things, it's not to say that one rape survivor will have them all, but I think a lot of them are quite common, just in terms of my own experience and just in terms of the research out there.
Thanks, Melissa. I think, sure, it's been amazing, a lot of the insights that you've provided. It's really taken us to the depths of the psychological trauma that women and children go through in terms of sexual violence. And I think of betrayal and of kind of the people that you trust, the society that you trust, because sometimes it is the people that are in control in terms of positions of power, maybe policemen or whatever, who might not take your statement, or who might not believe you, or might. So I'm not saying that that's a generalization, but it's a betrayal on a lot of fronts, and a lot of fear in terms of even fear of your body, like you've mentioned, that lets you down when you kind of you don't want whatever is happening to you against your will, and even in terms of, like you said, that it happens because of people we know, in places that we know, and where we feel safe. So it's a very, very frightening thing to have to contend with as a woman or a child in society. I think I'd like to, because we're talking about COVID-19 pandemic, we've been talking about that for a few weeks. Why do you think the rates of sexual violence have increased during this time?
Tanya, I think so. I mean, there's definitely been an increase, especially since lockdown level 3, I think it was. And I mean, we've been reading in the local newspapers and we've been seeing on TV in the news about how the rates of sexual violence have increased. And it's not to say that the rates weren't high to begin with. I mean, they definitely were. But if we look at it, we can definitely see an increase during the lockdown period. And I think a lot of people have been left wondering why. And I mean, there might be quite a few reasons behind that. But what my thinking is that because there's been such a disruption in our society, amidst a global pandemic, it's been a disruption. We've got a lot of anxiety that we're dealing with. As a society, there's a lot of unpredictability and there's a lot of fear and uncertainty about the future. I mean, we've never had to deal with a global pandemic before. So a lot of us are not sure. We're not sure how to act. We're not sure what to do. We're not sure about the future. And a lot of us are quite fearful and anxious. So that's the first thing. The other thing that the global pandemic presents is the sense of we don't have control over this. So there's like a loss of control about the future and about what's going to happen. All of a sudden, we all feel very like we're flailing about a little bit. So we're not in control of this thing. We're not in control of what's going to happen to us. And that's very frightening. So if you take, for example, somebody who, and obviously this is a generalization as well when we think of perpetrators of sexual violence, but if you think of someone who is prone to sexual violence to begin with, and then we are now, those same people are now faced with all of this ambiguity and all of this anxiety and unpredictability, the way in which they are going to try and retain some control is to engage in something that is going to remind them of how in control that they can feel. So if you look at sexual violence in that sense, the driving forces behind it are things like dominance and power and control. Those are the driving forces behind sexual violence and why it usually happens. So if you are faced with all of this unpredictability and uncertainty, and you want to try and grasp onto some kind of control, for some perpetrators, that means engaging in that kind of act to make themselves feel like they do still have some control. So I think that's possibly one of the reasons. The other reason as well, which I'm sure many of us have considered as well, is that with lockdown level 3, we introduced the sale of alcohol. And I mean, there's a lot of research that exists out there, South African research, which points to the link between alcohol use or alcohol abuse and sexual victimization. So the fact that, I mean, people have been panic buying, thinking that, there might be a ban that's imposed further on down the line. So people have been panic buying alcohol, beers, wine, whatever it is, and stockpiling it. And unfortunately, with that, I think there's been a natural increase in alcohol abuse and therefore a natural increase in the sexual victimization. I think that's one of the reasons as well.
So in other words, so the primary thing is that the people who actually commit sexual violence would be feeling out of control, and so the out of controlness of the pandemic makes them maybe act out even more so. And then secondly, and like you pointed out, very importantly, it's power, the power dynamic. In that's the way that they assert their control over women, is to commit the sexual violence. In terms of the alcohol abuse, it's made it worse. So it doesn't cause it to happen, but it will actually make maybe the effects worse. Is that correct?
Yes, and I think also if we think about just the general kinds of things that one worries about during this global pandemic. For example, the economic difficulties. I mean, there's a lot of people that have faced very, very challenging economic times. A lot of people have lost jobs, they've been retrenched. Financially, people are under a lot of strain. The economy is under a lot of strain. So it's really called into question, our future in terms of the economy and in terms of our job safety. So that alone will have contributed to a great source of stress and anxiety and unpredictability about the future. So if, as I say, there is someone who is naturally prone to violence before the lockdown, this lockdown period would have made that worse and would have led to a greater degree of wanting to regain some kind of control. And since we know that sexual violence is one of those things that is driven by the need for control and power, that would make sense that would increase during the lockdown period.
Absolutely. Thank you for those insights, Melissa. What could women do who are being sexually victimized now? What would you suggest?
Okay, so if women are being sexually victimized, if they are being abused in any kind of way, the first thing I would say is I would encourage them to act on their human rights. As a South African citizen and as a human being, you have the right to be protected from any kind of violence, any kind of gender-based violence. You have the right to be protected. You have the right to be taken care of. So my first thing that I would like to say is I would encourage them to act on their human rights and to seek help and to go out there and make it known that this is what's happening. Throughout the lockdown period, it has been very, very difficult. As far as I'm aware, the courts have all been fully functional and operational, so it shouldn't have affected it. Also, to initiate restraining orders and interdicts, I believe, has also been possible throughout the lockdown period as well. And it might seem like a very simple thing to do, but if there is someone who you can go to or who you can phone or you can call on for support, anybody who can provide you with a place of safety, who can provide you with physical safety and emotional safety, whether this is a friend or a family member, it can be a teacher, it can be somebody in the church, a pastor or a religious leader, anybody who you feel you can trust and who you can go to during this time, any kind of social support. I would encourage that as well.
Great, thank you. We have also put in a lot of the helplines in the comments in the discussion, so people who are interested can look there. It might not be all of the resources that are available, so if anybody knows extra resources, please add that in the comments as well, and let us know. So yeah, there's lots of resources that are available.
Sorry, Tanya, just to add something as well. There are a lot of resources out there, and gender-based violence organizations which are really helpful in offering psychological assistance and counseling. But also, in addition to the psychological help, there's a lot of centers which provide help in terms of medical issues and also in terms of pressing charges and getting ready for court. So I think one of the other myths that exists is that, or I'm not sure if I can even call it a myth, but one of the things that I think a lot of women think is that, if I press charges, it's going to be, it's not going to come to anything, and nothing's really going to change, and they probably won't get caught. They probably won't be arrested and found. So they're often put off by the lengthy procedures that are often involved with pressing charges. And I think it's important to note and to just inform everyone that there is help out there with that. So, for example, the Rape Crisis Centre in PE, as well as the Tujuzela Care Centre at Dora and Ginza Hospital in Port Elizabeth. I know they've got centres all over the country as well. They do offer court preparation as well, and also medical assistance for those that need it.
Wonderful. Thank you. Thank you for that. Actually, just interestingly enough, I saw something on the internet yesterday, like a kind of a safety procedure. So if you've got an interdict order or important documents that you might need, like birth certificates, marriage certificates, whatever, either keep them safe in a safe bag somewhere that is ready for when you need to leave, or if you can't get to those important documents, take a picture with your phone. So always keep that interdict order with you so that you can, when you go to the police and you need somebody to actually speak on your behalf, you've got that available and ready.
Absolutely.
Great. I think what I wanted to ask you, Melissa, is can we look at your but comment again from one of our regular viewers. Lovely. Welcome, Clinton.
Hello,
And
Clinton.
what did I want to ask you? Oh, yes. In terms of your research, is there any helpful feedback that you could give us in terms of the research participants, the actual survivors themselves?
Yes. So the study that I did focused on, as you mentioned earlier, adults, female rape survivors that have experienced rape and have also had some kind of psychological help following their rape. So whether this was done by a registered counselor or a psychologist, they had received some kind of counseling or intervention. So I interviewed those rape survivors and I asked them what it was about their counseling process that they found to be helpful, and also what they found to be not that helpful. And I really wanted to explore with them their reasons for why they found certain things more helpful than others, so that we could in future tailor our interventions to be able to target those areas a lot better. So interestingly, what came up in the research findings was that a lot of the normal kinds of interventions one would use for a rape survivor treatment, while they were seen as helpful, they weren't seen as the most helpful of all. The things that they found to be even more beneficial for their treatment and their recovery were things that were very related to the process of counseling. So, for example, the counselor's kindness that they showed towards the survivor and the warmth with which they carried out the counseling, the fact that they smiled, the fact that they hugged them at the end of the session, their sense of connection that they had with the rape survivor. Overall, that was actually seen as a lot more helpful and beneficial than some of the other more structured interventions. And I think the reason for that was because if you think about the act of rape, you realize just how dehumanizing it can actually be for the survivor. There's really an element of making someone feel like they are nothing and that they are not a human being. It's almost like an element of disconnection, complete dehumanization. And so it would make sense then that if a rape survivor is in counseling or treatment and there is almost like a restoration of that sense of connection, that would be seen as almost like a therapeutic tool in itself. So that sense of warmth, kindness, connection, making one feel like they matter and that they're important and that they are worthy again, was actually seen as far more beneficial and far more helpful than your typical kind of structured interventions, which was really quite surprising. But actually, when you think about it, it does make a lot of sense.
Absolutely. I was just reflecting on that now as you were speaking to me. To restore that humanitarian, that there is somebody who appreciates me, who cares about me, who I can trust, bringing in that element of trust again, and being able to be open and be able to speak about your experience in a non-judgmental, non-stigmatizing way.
Absolutely.
I think that's incredible. And of course, you can get that from close friends, somebody that you trust, a minister, a psychologist, a doctor, anybody, one of those organizations that we've pointed out, somebody like that who you feel you can reach out to and trust.
Absolutely.
Yeah. I think just something before we close up today. I just want to see if we've got any more questions. Please, if you've got any questions out there, please put them in in the comments and we can ask Melissa to answer them. Otherwise, Melissa will be available until the end of the show. So when we brought the other ladies up, we can also bring Melissa back to answer any questions that come up. However, there's just one question that I would like to ask you, Melissa, and I think it's something that a lot of people maybe sometimes misunderstand, and they kind of get upset with women who kind of stay in relationships that are abusive. I can totally get it why it's difficult to move out of a relationship. Maybe that there's security in that you'd love, and maybe you might have even have loved the person, or you still love the person. But why do women stay in abusive relationships when they're going through such trauma?
And I think, Tanya, I agree with you. I'm sure all of us know at least somebody who is in an abusive relationship, whether it's sexually abusive, physically abusive, and we might wonder that ourselves. We might wonder, I wonder why she's staying in this relationship. I wonder why she's struggling so much to leave. And the answer to that is quite a complex one. And just before I answer that question, just to kind of remind everyone, and just to highlight it again, is that rape, the act of rape and sexual victimization is not exclusively reserved for strangers. So it happens in marriages, it happens in intimate relationships. It really does happen. I think a lot of people think that, well, he's my boyfriend, so therefore it's not rape, or he's my husband, so therefore it's not rape. If the act is taking place without your consent, then it is rape, and then it is sexual victimization, whether it's your boyfriend or not, whether it's your husband or not. So I just want to start there. And as I say, the answer to that question is quite a complicated one. If we were to think about the reasons for why women generally stay in an abusive relationship, the first thing that comes to mind is for economic reasons. So, for example, there's a lot of women out there who depend on this individual for things like money and support, financial support, and should they leave, they would find themselves without that kind of support. So unfortunately, a lot of women feel that they have to stay, because if they don't stay, what's going to happen to me? I might be put out on the streets. I might not have any food to eat. How am I going to take care of the kids? So unfortunately, there is definitely an economic factor that comes into this as well. The other thing that I think forms part of the reason why women stay in abusive relationships is because if you think about abuse, and this extends to physical abuse, sexual abuse, all of those kinds of things. Abuse in general kind of follows a cycle. So, it will be really good. At some points, the relationship will be really good, and then it kind of gets a bit worse and a bit worse and a bit worse, and eventually it leads to kind of like an explosion of abuse. And then after that, it kind of goes back up again. So it starts feeling good again, and it gets okay, and things go back to normal. So abuse really does follow like a cyclical kind of thing. It's got a cyclical kind of lifespan, and I think we need to kind of recognize the fact that a woman in an abusive relationship, she acknowledges the good times, and she sees the good in this person. So the perpetrators of sexual violence are not all bad. They do have good in them. And this is what I think a woman might hold on to. There's this idea that, well, there are good times, and it might get better. Those good times might get more and more. We might get to a stage where we only have good times and none of this abuse is happening. So I think the intermittent aspect of the abuse is something that a lot of women hold on to. And, at the end of the day, if a woman if she loves this person, if it's her boyfriend or her husband and she loves him and she sees the good in him, it's very, very difficult for her to leave, even in spite of the fact that there's abuse in the relationship.
Thanks, Melissa. We're going to close up the section now, but I think just quickly I'm going to bring up, there's a question that's been asked by Clinton. He's not sure if this was covered as he tuned in late. Families of the victims of rape and trauma, and especially as a man, how to act, react, and treat the person affected. The last thing a person who loves the victim wants to be supportive and not unhelpful. It's very difficult to know how to be, if that makes sense. So I think he's trying to ask how to be or how to react if you've got a loved one who's going through trauma and rape, because you want to support the person and not do something that's unhelpful. What would be unhelpful? Can we maybe just say, because I think that would be a good place to start.
I think in terms of things that one would see as unhelpful, just in terms of, I'm just thinking back to my research participants as well. One of the things that stood out was having to endure people around you treating you differently. So kind of walking on eggshells around you as though you're broken or as though you are extremely fragile. I think that was one of the things that came up in the study as well. And then also just any kind of negative reactions of people. You know, there might be, as I mentioned earlier, there might be reactions of, you know, we need to keep this a secret because, you know, we don't want to split up the family, or, you know, let's not report it to the police because then we'll get a bad name in the community, you know, we'll get stigmatized in the community and those kinds of things. So I think to be supportive is to, or in terms of unhelpful things, I think those would probably be at the top of the list, is those negative reactions, and also just I think acting as though someone is, you know, fragile, broken. Helpful would be to be there and to be supportive and to listen and to try and understand. I mean, it's difficult because if you haven't been raped yourself, it's difficult for you to really understand what the person went through. But I don't think that really matters. I think as long as you're willing to listen and as long as you're willing to talk, I think that's all that's actually needed. In terms of my research findings, the interventions that were discussed, in terms of like your typical PTSD interventions that were used in the counseling, they did help, but there were so many other things that helped the survivors more. And those kinds of things are very, very easy to do, even for your average person, even for your average family member, is things like just show warmth and kindness. You know, physical touch, hugging. A lot of people think that rape survivors don't want to be hugged or touched, but they do. In fact, that was one of the things that came up in my study as well. The fact that the counselor hugged them at the end of the session. They really liked that. They really felt that that was beneficial for them. So a lot of the things are actually quite simple acts of kindness, which go a very long way in terms of a rape survivor's road to recovery.
Thank you so much, Melissa. This has been so informative, and I think there's a lot of information here that we can all go back on. This video will be available on all of our pages, including Melissa's. Please go back and look at it again, and any other questions later we can always answer in the discussion comments. I'm going to now welcome our other two ladies, our co-hosts. Thank you, Melissa. Will you stay behind in case I'm going to take your, but if you can stay available, that would be lovely to answer any questions. Thank you so much.
Pleasure.
Okay, and we're welcoming Jade and Marilee. Our last one, ladies, for this series. How do you feel?
I'll go first. Mixed feelings. Okay. It's been so exciting and really growth. I've felt there's been a lot of growth, but at the same time, it feels like we can get some normality again and not be on on screen for a while, which will be wonderful for some of us that are not really used to being on screen so much.
Yes, that was quite taking some time getting used to being on screen and being live. You can't go back and formulate an answer. You've got to do it live. So that's been quite challenging. How about you, Marilise?
I think as well, it's a challenge getting out of that little comfort zone. and sort of just start accepting it, that it's okay to be online, it's okay to be vulnerable and live in front of everybody. And yeah, also a little bit sad because it's nice to have people's interactions and get their feedback during the sessions and also afterwards. And I think it's going to be important for us to keep on asking the hard questions, to keep on having these discussions and these topics, and maybe on a regular basis going forward, have these type of conversations going forward with everybody. But it's been a very good learning curve, and I love the input. Thank you, Melissa, for all of that, because I definitely do have a bit of a question afterwards for you as well. So if we can keep on talking, it would be wonderful.
Well, we've got
And for
time.
you,
15 minutes. We've got 15 minutes, so we have got time that we'd love to answer them. Sorry, I heard a bit
okay.
of. Yeah, I think it's been a wonderful process. I've really enjoyed all of the discussions that we've had, right from mindfulness and bringing in our expert in Port Elizabeth, Dr. Margot de Kerker. She was amazing. She even did a live demonstration with us, which if anybody's interested, they can look back at that and see what she practiced with us, which was the breathing space, which was deeply relaxing and brought us in touch with our minds and our hearts, which is important. Jade's discussion was incredible. I really enjoyed hearing about relationships and how we can interact differently and treat each other with more respect and reverence. I really loved that. And then, of course, yours, Marilise, I thought that was also very, very insightful, dealing with trauma, which we've all had first-hand experience of and probably going to be seeing a lot more of in the coming months. So I think there's some really useful techniques that we've had and experienced. So I see a question now. Where can I get more information on relationships and meditation? Is there some short courses available? Thanks, Marilee. Sorry, Liz Marie. Not Marilee, Liz. Jade, would you like to maybe talk about relationships?
Yes, I can. There are some online courses in terms of relationships that I know Imago Africa are offering. I can perhaps put some of that in the comments a little bit later. And then in terms of where you are, you can also just look online for some relationship courses depending on where you're based. In Port Elizabeth, I know I'm keen to do some relationship stuff, but I know there are also other therapists that use different modalities that are also offering relationship workshops and courses as well. So I'll try and put some information in the comments a little bit later.
Great. And in terms of the meditation or mindfulness, Dr. Margot de Kerker is going to do some online courses. So that should be wonderful. And I'll also put information on how to contact Dr. Margot de Kerker on my page so that you can then interact directly with her. There's a lot of information out there. I was even seeing something yesterday. I think it's the British Psychological Society offering quite a few short courses as well on different aspects, free online courses. So we'll try and get together as many as we can and put them on our pages so that you can continue to grow and self-develop and give yourself some self-love and self-care, which that has really been the focus of our series, is self-care, how to deepen in that.
Yeah. Yes. If I can just say something quickly, just in listening to the talk from Melissa and just thinking about this theme of self-care and the words that really stuck out was around survival of being a victim and then coming out a survivor, and almost in terms of self-care is this rebuilding of your humanness, reclaiming or restoring who you are, getting that power back again, because there's that sense of powerlessness. So really embracing life and learning how to be fully alive again after something so traumatic has happened. I think that is part of why we want to offer this information, is that it is possible for people to regain their lives and regain that power and that sense of self and sense of control again, and to offer a place where there's hope, it's a hard topic. I was listening to Melissa and things that she was saying. It's so hard to verbalize some of those things, but it's so necessary because we need to take away the stigma and allow people to regain their sense of control in society again.
I think also a very valid point you've got there, Jade, because often when a woman is in this type of situation, or a man as well, because there can be violence towards both sexes, then they're thinking, I'm in this alone, I'm in this all on myself. There's nobody else to support me, nobody else is going to understand it. Or if they've been through it and they've been talking to the family or close friends, they don't want to keep on talking about it. And it slowly grinds away at their confidence and their person being, for lack of another word. And we have to continue having these conversations and talk about self-care, because part of self-care, and this is what I've noticed from our talks as well, is somebody saying, thank you for mentioning that. I don't feel so alone anymore. Thank you for raising that or bringing that up. And when somebody is experiencing these type of violences towards them, then they can sort of withdraw into society and everybody sees this beautiful picture of what's going on around them. But it is about they want to hide it. So when you do see somebody going through it, then ask a question, or as Melissa said, a kind word or a kind gesture. Just put that out there, but also coming back, be kind to yourself. There are so many support groups where you can just stay anonymous, or messages that you can send to stay anonymous, and just, I think, be kind to yourself. That's the one thing I want to put out is just keep on being kind to yourself.
Okay. Absolutely. I was reading on Yokusela Haven's page. They've got a beautiful page on Facebook, which you can also look at. That one of the myths about sexual violence is that women who've been through relationships like this, that's it. They won't be able to have a good, healthy relationship after that, and that's a myth. So I love what you said, Jade, there about hope, and what you were saying earlier is about resilience and survival, and what Melissa also spoke about during the discussion. Women can reach for a better relationship if they're able to discuss what's happened to them in a container of trust, with somebody that can really help them process the emotions and sort of go past that, go through it. They will be able to have a healthy relationship again. So that doesn't mean it's the end of the world and that the end of a good, healthy relationship. See another question from Alana. Are you thinking of continuing the series permanently? That would be lovely, but I think people might get tired of us every week. But we might come up with different topics. So what do you think, ladies? Shall we put our heads together for something in the future again?
Yeah,
definitely. Maybe once a term or something, or once in a while, we'll think of how long to stretch it out. But it definitely, and when we find some relevant topics for the time, I know with this whole Corona, that was the catalyst really of offering a space, because now we have to go online. So I definitely think it is a possibility.
I also think if there's topics that people would like for us to discuss, then please put it forward and post on any of our pages, Tanya's, Jade's, myself. We've now got Melissa as well, who did this lovely presentation for us. So please bring the discussions and topics and we'll talk about it.
That's great. So are there any more questions? We've got about 5 to 7 minutes left. Should I bring Melissa on to maybe see if she's got some reflections that maybe she's thought about, if she's heard us talking? Melissa, I'm just checking if it's still there. Okay, here you go. All four. The famous four.
Famous four.
Enid Blyton. Actually, that was the famous 5. I don't think it was
Melissa, I've got a question for you, and I think you brought it in so beautifully earlier on as well, that it will have some effect on the intimate relationship when there's been sexual violence towards a woman. So if a woman experienced sexual violence, maybe before, whether it was rape or molestation during teenage years, etc., and she experiences, which I think is quite normal, not everybody will experience it, but it is a normal part that can happen. If she experiences flashbacks during intimacy with a current partner, how do they navigate that as a couple? How can they sort of work through that? Because it can be worked through. Any
Yes,
advice there?
I think, Marlies, I think there needs to be two things that happen in that situation. I think that if one is speaking about flashbacks and intrusive kinds of memories, I mean that is very much a part of post-traumatic stress disorder. So it's very much it's a problem with the memory of the event. So it's yes, it is normal. It's a normal part of the aftermath of rape. And a lot of people will experience that. There are very, very good cognitive behavioral interventions to assist one with those kinds of symptoms, those kinds of PTSD specific symptoms. So that's the one thing that I would recommend happen. But the other thing that needs to happen is within the context of the relationship, just in terms of the couple themselves. I think that, if there is just open and honest and available communication between the two, and if there is an element of, educating oneself with regards to the symptoms of post-traumatic stress disorder, I think then if that starts to happen, there will naturally be an increase in one's understanding of what one is going through. So I think because a lot of people don't understand how intrusive memories work, it's quite a complex thing. So I think if one was to educate themselves on that and why it's happening, that they don't last forever. I mean, they are absolutely treatable. They are absolutely one can get better from PTSD. It's not a life sentence. It's not a permanent thing. So it does get better with the correct kinds of interventions. And I think just kind of continued support from the partner throughout those difficult times, and just educating yourself and continuing to show the warmth and the kindness, and create a relationship of trust. I think that's important, in addition to the individual herself getting treatment for those memories.
Thank you.
If I can just bring something in there, Melissa, I'm just thinking about like a couple who maybe the traumatic event happened many years ago and is resurfacing, and the partner also doesn't really know how to handle these intrusive memories and thoughts and these reactions from their loved one, and the changes in their reactions, and not being able to be intimate in the same way. And that can be very frustrating. And I've sometimes seen people get really frustrated and almost want to push their partner to get better quickly. And that can cause them even more difficulty in the relationship. So something that I'm thinking about is how to create safety again in the relationship. And for if your partner has experienced some kind of sexual trauma or trauma in general, is how can they feel safe again? How can they feel protected again? And maybe it's a question more than me giving an answer to it, but maybe we can all just open up that a little bit. How to create safety.
Yeah, I think that's very, very important, because if you think about just trauma in general, so not specifically sexual trauma, but any kind of trauma, it really creates, it's got the potential to change the way in which you view safety. So it really can make you feel like you yourself are not safe anymore, and the world within which you live is not safe anymore, and the people that you thought were safe are not safe anymore. So it really has got this big level of unpredictability and uncertainty and fear. So I think there's so many ways, you can really unpack this quite a bit, but there's so many ways in which a couple could work at trying to restore that sense of safety. through things like consistency, just love and support and understanding and patience. I mean, PTSD is a clinical disorder. It doesn't go away overnight. Sometimes we wish that we could wave a magic wand and it would get better straight away, but unfortunately that's not the case, and it takes a lot of hard work and a lot of time. So just kind of educating yourself in terms of how long this might actually take and what's required of us during this period of time. I think that would also be important. I'm not sure if anyone else has any more ideas.
I just think it's important not to rush the rape survivor or the person who's gone through sexual violence. I can really hear deeply the issues to do with safety, security, and so it needs to be done in a safe container. I think communication is vital. So finding a space where you can communicate with your partner in a safe space and taking the time that the person needs, I think just will recreate and build that relationship into one of trust. It's just my feedback.
Thank you. Yeah, and just one more thing, I think that the question is, what do you need? If we ask our partners that, what do you need? What can I do? And that question in itself helps to create a sense of safety and awareness that your needs might be slightly different, but I'm willing to offer what you need.
Jade, and just a follow-on comment from that as well. I agree with you, and I think if I just think back to my own study and my own research with the rape survivors, you're right. Everybody's needs differ, and some survivors were not psychologically ready to face certain kinds of interventions. So while we assume that exposure therapy might be something that is beneficial for rape survivors, it wasn't experienced as such if the timing was off. So if the intervention was introduced too early, it was actually experienced as very negative and very unhelpful. So getting the timing right and kind of saying to someone, what do you need from me right now, is very, very important in terms of relationships, but also in terms of treatment.
Okay, thank you.
Oh. Incredible. We've now reached 12:30. I think all these discussions have been very amazing today in terms of insight and really understanding, particularly sexual violence and for the survivors themselves, what's important for them. Is there anything that you'd like to end off with? Last words before we say goodbye to everybody out there? Marlies, what would you like to say?
I think it's been a great privilege for me to be on here and to be part of this team as well, because we go into people's homes. So I just want to say thank you to people for allowing us into your home and listening to what we have to say. If you need help, there's so many people out there that really is willing to help and with kindness and non-judgment, wanting to help. So please reach out to them if you can. Thank you to you ladies, Tanya and Jade and Melissa for today, and Dr. Margot that we had on as well, for being part of this journey for us, this maiden voyage for us. And I hope that there's going to be many more voyages to come still. Thank you very much.
Thank you. And you, Jade? Any last words?
Definitely, just a big thank you. I've really enjoyed it. I've really enjoyed the support of the listeners and the viewers and the questions and engagement. It's really got us thinking. And for me, it's also stirred up some things in terms of my professional journey as well, and working with relationships, and just really reconnecting me to some of my passions that in this time with the lockdown maybe were a bit quiet. So thank you for this opportunity, and thanks, Tanya, for helping us out with the tech, and to everybody. Yeah, it's been really a growth journey, definitely meaningful one.
Well, I'd just like to say thank you to both of my co-hosts, Jade Brown and Marilise Laram from Listening Well. Thank you so much. I've really enjoyed this journey with you. I've enjoyed learning new things, particularly on the technological side. I've had a lot of insights, and I've really enjoyed the topics that we've put out there. I think that they're beneficial for everybody, and to stimulate thought and just new ways of thinking about things. And particularly thank you to you, Melissa, for today. I think it's a topic that we could spend a lot of time on, and really to do justice to it, it needs to be something that everybody in South Africa puts their thoughts, minds, and hearts and actions into to support women on their journey and children,
Thank
women,
you,
and
ladies.
victims. Thank you,
Thank you for
everybody.
having me.
Thank you. Okay, well, thank you very much. I'm going to end the broadcast now. Thank you again, and enjoy your Thursday. And look on our pages for future events. Thank you so
Yes.
much.
Bye. Thank you.
Bye.